Does your employer insurance count as Creditable Medicare Part B? Imagine you're turning 65 and wondering how your current health coverage fits with Medicare. You might have questions about whether your employer insurance will count when you sign up for Medicare Part B. Well, let's explore how employer insurance interacts with Medicare to help you make the best choice. First, it depends on the size of your employer. A large employer is defined as having 20 or more full-time employees. If you work for or are covered by a large employer, your employer's insurance usually counts as creditable coverage for Medicare Part B. This means your employer plan covers at least as much as Medicare does, so you can delay enrolling in Part B without facing penalties. If your employer has fewer than 20 employees, it is considered a small employer. In this case, most health plans do not qualify as creditable coverage for Medicare Part B. When you turn 65, Medicare will typically become the primary payer, and your employer plan becomes secondary. To avoid gaps in coverage, you will need to enroll in Medicare Part B when you turn 65. It's a good idea to check with your employer's Human Resources or Benefits Department. Ask if your insurance plan is considered creditable coverage under Medicare rules. They can confirm whether your plan covers at least the same services as Medicare Part B. If your employer insurance is creditable and you decide to delay signing up for Medicare Part B, keep records of your coverage. This documentation can help you avoid late enrollment penalties later on. When your employment ends or you retire, you have up to 8 months to sign up for Medicare Part B without penalty. This is called a special enrollment period. Remember, if your employer coverage counts as creditable, you can usually hold off on enrolling in Medicare Part B without worry. But if it does not, enrolling at age 65 is important to prevent coverage gaps and penalties. Always verify your coverage status and keep good records. This way, you can smoothly coordinate your employer insurance with Medicare and stay protected.